This week on Africa Health Check.
There's also illustration on when big stores and restaurants, bars can operate.
It was very good in terms of being with the family, but the bad things was that you are going to the house empty-handed.
We analyze the effect that the COVID-19 pandemic,
lockdown meant nobody could go anywhere, people are not working, people are starving. It was chaotic.
has had on food security on the continent. Hello, good day, and welcome to Africa Health Check. This is where we reflect on Africa's response to the COVID-19 pandemic. I am Khokgontle Jampaladi. Food security is among the sectors that were acutely affected by the COVID-19 pandemic. Supply chains, the agricultural sector, production, and other factors were negatively affected by the restrictions, particularly on movement as a result of the COVID-19 pandemic. This is why on today's episode, we will be discussing the impact of COVID-19 on food security in Africa. But before we do that, let us have a look at Africa in numbers. This week on Africa in Numbers, we look at the daily new COVID-19 death rates on the continent and highlight the 5 countries reporting the highest 7-day average rates as of the 30th of January 2022. South Africa's 120 daily deaths is the highest daily death rate average on the continent, followed by Tunisia with 39, Egypt with 34, Morocco with 31, and Libya reporting an average of 13 daily deaths. For more on these statistics, log on to the official Africa CDC website. And that is our Africa in Numbers for this episode. As I've already said, we will be discussing the impact of COVID-19 on food security in Africa. And to help me with that discussion, I have our guest panelist for this episode, Mary Michelle, the founder of Kiwonongo Foundation from Uganda. We also have our usual commentators, Dr. Marianne Morathi, the current chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we hear from these experts, let us have a look at this week's feature.
My name is Newman. I'm a very young, energetic, young professional. I'm an entrepreneur myself, born and raised in Gaborone, which is the city center of Botswana. My inspiration really to get into business started because of my parents. So I was so much involved either with my father when he was traveling around the country doing his profession, or I was always with my mother at his tuck shop when he was cooking and serving people food. I remembered that I always wanted to be better than my parents. So my business calling and intuition started coming so deep now into me. And I started my own business in 2010. That's when I started Pullman, which the idea was to own big trucks and the property and the likes. But it didn't materialize. So fast forward 2013, and that's where my events company called Native Events was born. 2015, I ventured more into other businesses which were in support of these other two. Pullman still existed, but it was not in traction at that particular time. So Native was doing most of the business. So COVID hit, I would say, it literally hit everybody. People are on lockdown. There is an initiative by the president to distribute food packages because lockdown meant nobody could go anywhere. People are not working. People are starving. It was chaotic. So I reached out to them to say, within my locality, which is Gaborone, I'm willing to offer you 100,000 kilometers worth of service with my fleet of trucks to try and speed up and facilitate the distribution of food packages to homes through the help of the city council and my trucks, and being able to really work together as a community towards a common goal of restoring people's faith and making them feel like there's hope, there's light at the end of the tunnel. So I was able to take my businesses that were at that time relevant to the market, which are into the creative industry, which is the agency and the events company. We're able to come together as a team and restructure and think outside the box. That's when the birth of virtual and hybrid events came. And we were one of the few, if not first, to offer green screen technology and having to virtually connect people from working from home and being able to access information just like they used to do before. So this really helped down on controlling the spread of COVID, because people were still able to access entertainment or information without having to really physically interact and leave their homes. We have to understand that there's a difference between an idea and a business. You might be having the most brilliant idea right now, but until tested and proven, that's when you can know if it's going to succeed. But nowadays, the world has shifted, and we need to put ourselves in a position that whatever ideas or businesses we start right now, they become globally competitive, as well as catering for your locality. So don't think local, but think global.
And that is our feature for this episode, from my fellow countrymen, Newman, doing such incredible work to support the response to COVID-19. Keep up the great work. We're going to dive straight into the discussion, which is the impact of COVID-19 on food security in Africa. I'm going to go straight to our guest panelist, Mary Michelle. Welcome to the show.
My name is Mary Michelle. I was born in Chiwonongo Foundation, in Chiwonongo, which is found in Ruamata sub-county in Chiboga district in Uganda. And I reside currently in Florida, USA. Thank you for having me.
So give us a bit of a background. Who is Mary Michelle, and a bit of background on the work that you do and how you started your foundation.
Well, I was born and raised in these areas called Chiwonongo. And by the way, that word means something like a crevice or a cave where you go and you never come back. So unfortunately or fortunately, I came out of that cave and I flourished. So I started this foundation called Chiwonongo Foundation to help educate the children, educate the youth and their mothers as a pillar of eliminating the poverty due to mostly to lack of education. People are devastated by poverty, lack of education, young children, young girls getting married and getting pregnant and producing children.
Absolutely. So maybe just share a bit of background on the work that you have been doing relating to food security in your community over the last 2 years of a COVID-19 pandemic.
Good enough. We are privileged to have enough land for growing food. So I hired, when the school closed, because when the school closed, children were helping with producing food and the youth were helping in producing food. So when the school closed, I had to hire manpower to use almost much of our acreage to grow food. And that has sustained us from the beginning of COVID up to now. We are doing very well, except for the season where it was so dry and the whole season we couldn't produce food. But the rain has come back and we have managed to use up most of these acres to produce food.
Wow. And is this just for the consumption of the students in the local community, or is it also for commercial purposes? Like, are they using it as an income generating resource as well?
We are using it for consumption mainly because we have a full school. Before COVID, we had a full school of almost 400 children and about 25 staff members. So at that point, it was used, it is mostly used for consumption. And during COVID, because of lack of interaction between community members, the youth group, the women group that we had, we have a youth group and a women group. And the school children, most of the school children had to go back home, and the teachers had to go back home. So most of the food we grew is used for consumption. But if it was not this food production, our children couldn't have survived through the COVID. The children and the local community that is nearby.
A really incredible work that you have done, Mary Michelle. And maybe just to share with us, what kind of support did you receive from the community, the stakeholders, when you started this project of growing agricultural produce at the school for the consumption by the students?
We have a local school board, parents, teachers, community that combine efforts. But also you have to remember that most of the teachers had left, and of course the local community was scared of meeting. They were losing their families due to COVID. So the meeting and the interaction and exchange of information was very low, because of the fear of catching COVID. So evidently we have a local community support, but as you know, when you are poor, you can only contribute this much. So we gained a few information of how to preserve the food and have it at least for the next year, or prevent pesticides. We had a local family member who is a farmer, and she had to come up with an idea of helping us how to keep our goats and our cows. And that helped us a lot because it was hard to find a veterinarian. So we have some family support and the community support and the organization support. The problem was COVID, because the interaction was not supposed to take place because of fear.
Absolutely, which makes your story even more powerful, because it means that for many of the families that you were assisting, this was the best and only option that they had to sustain their livelihoods during the tough times of COVID-19 in the previous year. I'm going to quickly jump to Reverend Anthony Achampo. Maybe you could just share with us about Ghana and how has been the situation with food security.
Thank you very much, Gigi. Let me do some definitions here for the average person that is tuned to our program. When we talk about food security, it has 4 dimensions. Number 1, we're talking about adequate and available food for consumers. Number 2, we talk about high quality food that guarantees a balanced diet. And number 3, we're talking about affordability, low prices of these good food. And then number 4, the guarantee that this food will give good health to people. In Ghana, the inception of the COVID virus brought a lot of challenges. People face a lot of difficulties. Firstly, at the announcement that there will be a lockdown because of COVID, and people didn't know how long it would take. Some people, I would say, went into stockpiling, is panic buying, and that created a temporary shortages, and then also pushed prices up because foods were not available. Everybody was trying to stockpile as much as they could. I mean, those who could afford. Secondly, the challenges came as a result of the fact that borders were closed, airplanes and other means of transport from foreign countries, even countries around Ghana, could not bring in foodstuffs. And it's on record that Ghana receives a lot from Burkina Faso, from Mali, from Niger, from Togo, and other neighboring countries. And so they couldn't come, and this also exacerbated the prices of foods.
Absolutely, and I'm really happy to hear that this was a collective effort from different stakeholders in the community. Thank you for sharing that. I'm going to jump to Dr. Marian to just share some experiences on what some of the food security initiatives that came up as a result of COVID-19 in Kenya were. So, Dr. Marian, over to you.
So in terms of food security in Kenya, first of all, we started off as where donations would come in and first of all, cater for the poorest in the society. There were ventures, particularly led by the church and temples, where they'd have food drives, making sure that the most vulnerable, remember businesses shut down, people didn't have money in their pockets to buy food. So at most to took care of that need at that time. But now later on, when we had now the economy breaking up and people learning how to live with the virus, having all these measures and vaccines, we now have initiatives that are helping farmers go back to basics in terms of, are they farming right? Are they using the correct conditions? Are they timing the weather to make sure that they're planting the right items for the right crop? Allow me also to talk about also in the medical setting as well. We saw quite a bit of malnutrition in that first few weeks, where again people lacked enough food, were not eating balanced diets, and this adversely affected their overall capability of fighting some infections. On the other hand, we had others who were overdosing themselves with vitamin C. We all heard about vitamin C and how it can boost your immunity. But now the other adverse effect is that it leads to kidney stones and other various complications. So too much of everything is bad. And if you can derive some of these nutrients naturally, the better, to avoid you coming to the clinics or casualty with uncontrollable pain. And how do we do that? We have to make sure, as much as we're making sure everyone is eating well and is satisfied, that they're eating a balanced diet. So that's why we need to educate our farmers, our women groups, the youth, and also children on how to balance their food, eat correctly, and wash their hands. Food hygiene that comes around with handling of food that is well adhered to, and that, of course, we have to make sure we have clean water. So it's a whole cycle of events, a whole cycle, a team of different experts that participate in ensuring that there's food and there's food security and people are eating well and healthy. That also makes us in the health sector quite happy to have a generally healthy person, because they're able to fight other infections, not just COVID, in a much better way.
Thank you very much for sharing the Kenyan experience, Dr. Mary. And the key word there is that it's a multifaceted approach. And I'm really happy to learn of the different stakeholders that were working together to safeguard food security during COVID-19. We're going to go for a quick break. On the other side, we're going to be discussing the lessons learned from the food security challenges we experienced in the last 2 years. But now it's time for us to hear what people on the street had to say.
Pour moi, personnellement, ça m'avait beaucoup affecté. Et je pourrais dire que par rapport à mes activités, tout ce que je suis en train de faire, j'avais perdu beaucoup. J'avais perdu beaucoup en termes d'épargne ou de ce que je suis en train de gagner pour pouvoir subvenir à ma famille.
The measures that were taken really affected me. In my hotel, I used to sell up to 10. Now it had to reduce because most of the bachelors used to come and eat at that time. But now, upon the measurements that were taken, some maybe you had late lunch, so they didn't have the time to come to my hotel and do to take the food or take away. So my business really went down.
I'm a business person. I own a restaurant. So due to COVID-19, my restaurant was closed because there were lockdowns, and my family was really affected because it's depending on the restaurant for food.
Coming back from the word on the street about what people think about the impact of COVID-19 on food security, we are jumping back into a conversation with our panelists. And I'm going to go to Mary Michelle. Earlier on, Reverend Achampong was talking about how because we import so many of our goods, our commodities, we had so many challenges because of the restricted movements and the need for permits and so on and so forth, particularly for cross-border traveling. So what have we learned as Africa, as African countries, about the need to reduce our high importation bill just from the experience of COVID-19?
From my standpoint of view, our country needs to put in place procedures to prevent the spread of COVID, as well as allowing the importation to increase. But in my case, in our community, as the Reverend has said, we rely mostly on locally grown food. Unfortunately, these 3 months when the oil and the petrol has gone up, the prices also have doubled. So even if we have food, even if the rain is here, even if there is manpower to do the growing, other items cannot be afforded. We cannot afford to buy salt, we cannot afford to buy sugar or to buy petrol to move around. But we hope that the government will improve and send us some help and continue to import other things that we do not have, and also put in place preventive measures for COVID so that people can be able to move around and do business as usual. Then that can stop the hiking of prices on other items that we don't grow.
Absolutely, preservation of food. I'm going to go to Reverend Anthony Achampong. Any comments regarding the agricultural commodity price index that has been fluctuating and is still not where it was just before the beginning of the pandemic?
Let me say that there are many sides to this question. And let me say this to our government leaders, our opinion leaders. This time-tested wisdom or maxim that a healthy nation is a wealthy nation, and a balanced diet is a requirement for good health. And without good health, no nation can aspire to progress. I believe that our leaders, especially government leaders, should have a graded policy. Let me call it short-term, medium-term, long-term policies where food, agricultural products are concerned. So let our government leaders, let our policy directors come up with real plans, concerted plans, research plans about production, about storage, about eliminating all the bottlenecks that forces prices up, and then also making sure that our food items are hygienic. So let government take care of some of these things that are aligned, and prices will go down. Our people will eat plenty and they will eat healthy, and we will all be fine.
Absolutely agree with you, Reverend. And maybe just to introduce a little contradictory comment to what you're saying earlier about how, of course, we'll always need commodities from other countries. And to rope in Dr. Mary Ann, I went on a trip to Chile a couple of years ago, and I realized that Chile is the biggest producer, exporter, the second maybe in the world of salmon. But it's not native to Chile. They just identified a market and decided to create the appropriate climatic conditions in Chile to be able to export salmon. Why is it that in Africa we can't have that kind of attitude towards agriculture? Why is it that we only focus on the crops that we can grow and consume in the country? Why are we not going beyond our normal comfort zone in the agricultural sector? Dr. Mary Ann.
topic, and it all calls to being innovative. And I'm really impressed by what you've just said about Chile. So what stops us from being innovative? And this is where we need to bring back the topic of the youth. First of all, we need to reintroduce the youth into agricultural practices. The youth have run away in our university from courses that are driven towards agriculture, using their hands and being innovative, creating measures, creating climate conditions. Maybe is it a greenhouse that you need? You need to have some infrastructure prepared. Look at Israel also. It's more or less a desert, but really they export quite a lot of produces. So nothing stops us really. It's just going back to basics. Trusting and entrusting our youth to lead us in these innovations and having structures and measures. And Reverend talked about soft loans. Can the government partner with us when we're talking about this technical capability? Allow me also to bring in, it's out of my scope, but also climate change. Are we doing something that makes sure that we are not adversely affecting our climate? Are we going around cutting off trees and creating an atmosphere that will not allow these things to grow or lead us to certification and lack of food altogether? So all these things play a really big role. And it goes back to now where I'm passionate about health. What type of food do we have? And allow me to mention about, yes, we have grains in Kenya in particular, but do our farmers know how to store these grains? Because if we don't store food properly post-harvest, as Mary Michelle and the Reverend have spoken, we then create an environment to have microbes such as fungi. We have something called aflatoxins. Aflatoxins adversely affect our health in terms of how our immune system responds to infections such as cancers as well. So we have to play in a partnership where the health sector is involved, the farmer is involved, the scientists are involved to create an environment where we have food security, health in our food, and end of the day, as we have said, a healthy nation is a wealthy nation.
Absolutely, Dr. Mary. And I'm going to go to Mary Michelle. And as our guest for today, you have the parting shot. We are pressed on time so in just a minute or less, just give us your final message regarding this.
Thank you very much for having me again. My final message would be to the stakeholders, the higher stakeholders, the representation group of each local community. We need your linkage. We need you to come and help us, but also, as in my position, we are doing a lot of awareness program, skills training, youth training, women training, and children education, because with a higher illiteracy rate, there is nothing that can go on if people cannot read, if people cannot write, understand the nutritional benefits of their food, understand how to prevent diseases that are locally affecting them, understand how to store their own food instead of relying from the garden to the table, and that's the end of it. So we are doing a lot of awareness, training, and education so that the nation for tomorrow knows how to grow their food properly. They know how to stop deforestation, support climate change, and to have nutritional foods that they locally grow and to understand them.
Absolutely couldn't have ended it any better. Thank you so much, Mary Michelle, Dr. Marianne, and Reverend Achampong for your time and having such really enriching conversation around food security in Africa. Do remember that food security is not, or achieving food security rather, is not an event. It is a process, and it needs all of us as different stakeholders playing our role from our localities and also at an individual level. This is Africa Health Check. Do remember to connect with us on social media platforms. We would love to hear from you. Until we meet again, same time, same place, remember that the future is Africa. The future is today.